Do you have problems with your ankles? You might be a candidate for ankle replacement surgery with TSAOG Orthopaedics and Spine. And here to tell us more is Dr. Justin Robbins. He's a foot and ankle surgeon. Welcome, welcome, doctor.
Yeah, thank you.
All right, so tell us a little bit about yourself and TSAOG Orthopaedics and Spine.
Yeah, well, my name's Justin Robbins. I'm an orthopedic surgeon that specializes in foot and ankle surgery. I'm part of the San Antonio Orthopedic Group. We have multiple orthopedic subspecialties in our group. We're the largest orthopedic group in town.
All right, and so as an orthopedic surgeon, what conditions do you typically operate on?
So for me, I specialize in ankle and foot reconstruction. So I'll take care of patients who have fractures to their ankle or foot, tendon or ligament injuries, overuse injuries, or arthritis to their ankle.
So what is arthritis to the ankle?
Yeah, so arthritis of the ankle is where the cartilage starts to wear down and patients will start to develop swelling and pain and decreased range of motion to their ankle.
And so what is a candidate for ankle replacement surgery, you know?
Yeah.
How does it get to that point?
So any patient that no longer is responding to the non-surgical treatments for ankle arthritis are patients that we do an ankle replacement on. An ankle replacement is where we take the ankle joint and we remove the arthritic portions of the joint and then we replace it with metal here on the end of the tibia or shin bone and here on the talus bone, the one that allows the ankle to move up and down. And then we put a plastic liner in between to allow for smooth ankle range of motion.
And so what is recovery like and how long can that take?
Yeah, so for an ankle replacement, that surgery typically takes about 2 to 3 hours to do. Several patients are able to go home the same day. Some patients need to stay in the hospital overnight. Because I do that surgery through an incision in the front part of their ankle, I need that skin to heal before they start walking on it. So I keep patients in a cast for anywhere from 3 to 6 weeks. And at the 3 to 6 week mark, I let them start walking in a walking boot. And usually by 9 to 12 weeks, they're back into a regular shoe. Patients will continue to get improvement in their motion and their pain for up to about 2 years after surgery.
So up to 2 years after surgery, okay. And so any tips for folks who might be having ankle problems, but maybe they're just not ready for surgery yet?
Sure, yeah, for patients that have ankle arthritis, initially treating it with things like rest, ice, compression, elevation, are all things that patients can do on their own. If their pain persists, that's where they should seek an orthopedic surgeon that specializes in foot and ankle surgery. And at that point, we can try things like injections or prescription medicines or braces or physical therapy. And if those things stop working, that's where we start thinking about surgery.
Yeah. Okay, and that's where they can go to you, Dr. Robbins. Thank you so much. To book an appointment with Dr. Justin Robbins at TSAOG Orthopaedics and Spine, just call 210-804-5400 or visit the website tsaog.com.